Yes, go ahead.
Doctor, certainly. Yes, briefly.
I'd just like to support what you said in terms of recent global estimates that the World Health Organization put out just last week that you might be familiar with, talking about safe, less safe, and least safe abortions and their distribution globally. And in fact, we find that by medical standards and WHO guidelines, self-management of medication abortion, the way it is described in Women on Web, does fall within safety criteria and would be considered safe. But in countries, and we saw this particularly in the Latin American region, where access through clinic services is not available, a number of women are accessing online, not specifically from Women on Web, because that's one service and cannot reach the majority of women who need it, but through a wide variety of often unregulated and unknown quality online services, which we call less safe. Simply because they do not necessarily have the access to the counseling, they do not necessarily have access to adequate information, they do not have access to follow-up care. Now, it is still a paradoxical situation that the mortality and deaths from even this type of care seeking is much lower than the dangerous methods that Dr. Abigail mentioned about coat hangers and bleach. So it, in fact, might hide a situation where women are not receiving appropriate and adequate care, but we do not see it as a public health problem because deaths are not happening. And that's something that we need to be aware and conscious of.
Thank you, Doctor.